You're 76 years old with peripheral vascular disease and diabetes. You've made great improvements in your health journey, only to be set back by an acute illness to the point where you can't walk again. What do you do next? Welcome back to Montgomery Heart Wellness, and we have an excellent clinical rounds discussion with you today. This is a patient who has been to our center before. It's a 76-year-old man with diabetes and had really bad peripheral vascular disease, and he had great strides for improvement from my recollection.
Yes.
But then he went home and was hit by an acute illness. What happened there?
Yeah, so when he was at home, he developed pneumonia and got sick, and he was dehydrated as well, and the blood pressure was elevated because we know infections can elevate your blood pressure as like a systemic inflammatory response type of syndrome. So the practitioner had prescribed the patient a high dose of a blood pressure medication called nifedipine that then ended up really lowering that blood pressure too much, and that on top of struggling to hydrate well really caused a sudden acute change in his extremities.
So probably what happened was, so he was volume depleted and perhaps over medicated, and we often see patients who are in the health journey and making improvements in their circulation. Vascular structures are not like pipes. It's not like you rotor-rooter them and they're open and they plug up, and they're physiological devices. And here's an excellent example of how the body and the circulation reacted physiologically. In his microcirculation, the endothelial cells were probably damaged or probably acutely assaulted, if you will. The endothelial cells, for many of you may not know, are the cells that consist of the inner lining of the blood vessels, and they're really an organ system. So these endothelial cells, they secrete important hormones, one of which is nitric oxide. And so the healthier these cells are, the better your blood vessels are, the better your blood pressure is. And so in certain situations when you're in the process of healing, so in this situation, he had come to our program, he was on a nutritionally excellent diet and undergone sauna therapy, etc. His vascular structure was in the process of healing, but probably wasn't totally healed. So the insult of the infection probably caused increased inflammation, increased oxidative stress, plus being over-medicated, being volume depleted. So his vascular structure took a major insult, and that led him back to having worse circulation, to the point I think he was on crutches. He was having such pain.
Yeah, he came back here and was back on crutches and had more pain on the plantar surface or underside of the feet.
So essentially what we did, we started back from scratch with a nutritional detox. Now in this situation, we treated him with not only the detox diet, but he had received more phosphatidylcholine infusion. One day I noticed he was walking and he became a little bit short of breath by high step walking, and so we added external counterpulsation treatment, like ECP therapy. Now, ECP therapy also improves endothelial function, and it's thought to improve endothelial function by a massaging effect that has the endothelial cells produce more nitric oxide. So not only it works in the heart, but it also works on the periphery as well. So I think these added effects, had a benefit in its peripheral circulation, and I think its energy is picked up too. So the systemic vascular tree was treated effectively with these synergistic effects. And I really want to emphasize that when you're treating vascular disease, some people may present with heart disease, more so. Some people may present with peripheral vascular disease, more so symptomatically. Some people may present more with cerebral vascular disease, so they may have strokes or TIAs. But in virtually every case, they have vascular disease throughout.
While his most up-to-date progress, he now walked a little bit over a mile without stopping, without his crutches. His feet are warm again. So his symptomology has significantly improved.
No more crutches.
Right.
Now, what were the numbers? So when did he start? Now, when he came to see us the first time, we do a test to quantify the circulation called ABIs, ankle-brachial index. We like that ratio to be roughly 1. It can be 1.2. We don't want it to be too high. But his ratios are pretty low when he started at the very beginning.
Right. Before, at his worst, the ratio on the right was 0.5 was his ABI score, and on the left was 0.3. You know, when we had saw him the first time, he still had really low scores of 0.68 and 0.47.
So that's, in other words, the circulation to the lower extremities was significantly less than to the upper extremities. You think when you walk on your feet, you should have at least equal circulation to the lower extremities, maybe even more. So he had very bad peripheral vascular disease at the very beginning. And so the first round of therapy, we got him from those numbers to where?
So we went up to 0.73 on the right and 0.96 on the left. So
Yeah.
that was awesome.
So it made an improvement. So then he left, went back home with plans to come back, and then he was hit by the acute illness.
Right.
Came back somewhat urgently, and then what were his measurements when he came back?
So on the right, we couldn't even pick up a measurement, which usually means severe reduced blood flow. And then on the left, it was 0.68. So it did go down about 30% from where it was before.
So when he came back, the circulation on the right was so poor, it was just only capillary flow probably getting to that area to where we couldn't measure a pulse. So that's how severe that insult was. And so his vessels were probably spasmed due to the insult, and then it needs some recovery. So after our intervention, nutrition, sauna, ECV therapy, those numbers improved to what?
So the right went up to 0.94 and the left went up to 0.97.
So, I mean, that's excellent. Those are almost normal numbers. And so he's walking over a mile without crutches. And he has another condition called restless leg syndrome, in which that's getting better too, probably due to some of the systemic improvement biochemically and metabolically. So this is really an exciting case to show you how delicate the circulation can be. And these setbacks are often due to environmental insults, infections, etc. If someone relapses on their diet, they can have a setback. So there are different things that cause a setback and improvement. However, you can always come back. So very, very important and exciting case. So any other comments?
I think what you said holds true, and it illustrates, and even if there's a setback, don't let that bring you down, and you can improve and get to an even better place than where you were before.
The body's incredible. So I hope you enjoyed this. If you have any questions or comments, leave them in the comment section. And until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button.